Hi, I'm here to talk to you a little bit about Narcan. Narcan is a medication used to reverse the effects of an opiate. An opiate is a drug like heroin. It's very common right now that heroin's got an epidemic proportion in this country. It's gone up by over 700% in the last 10 years with people using it. There's a lot of reasons for that. I'm not going to really get into those today. The problem is we have these patients who are overdosing with the use of their heroin. Now what we're going to do is show you how to give a medication to reverse that. That medication is called Narcan, or naloxone is the other name for it. Narcan, we're going to be giving the patient 4 milligrams of this drug to help reverse the effects of the opiate. In your brain, where this opiate is attaching to the synapses, is causing the effects that the patient's having. The high or whatever they're getting off of it, and also depresses the respiratory system and knocks that out. What the Narcan does is it interferes with those same receptor sites, preventing them from doing their actions. And because Narcan attaches better to the receptor sites than the opiate does, it will stop the effects. On the ambulance, when we give this medication, we use it in something like this here. And I'm just going to show you what the spray looks like as it's being atomized. So if you see this, I'm going to spray it for a long period of time here. This is more medication than we normally would give. But you can see how it's being atomized. How this is received in the nose, it doesn't actually go into the lungs. In the top of your nose, you actually have these little membranes, and these membranes is where the medication is absorbed. And it's absorbed very, very quickly. So fast, in fact, that if the patient were to sneeze after giving the medication, it would still be effective. So I'll go ahead and open this up and show you how to give it to the patient. We have to find our patient, and we have to do an assessment of the patient. Because we have to kind of determine here whether this patient is just sleeping or they're actually having an opiate overdose. Now it might be something because we know about the patient, we know they have a drug habit, a drug concern, those types of things. Or maybe that's been reported to us. So come up to the patient, sir, are you okay? There's no response. And now my concern here is the patient breathing properly. Do I see the chest rise and fall? I also look for other injuries that might occur because the patient may have fallen. So I can put my hand on the patient's chest, and if they're breathing less than 8 times a minute, or 8 to 12 times a minute, we want to give the medication. The best way to determine that is I'm going to watch the chest rise and fall and count how many times that happens in 15 seconds. If it's happening more than 3 to 4 times in 15 seconds, I'm okay. The patient doesn't need this medication. Because our goal is not to wake the patient up. I'm going to show you a quick video here of what it looks like if a patient is brought around too quickly with Narcan.
Started bagging him. He wasn't breathing. He had a real rapid, thready pulse, and he wasn't breathing. Then we gave him medicines to wake him up with some Narcan.
Lay back. Hey, security.
You call San Diego PD? Don't move. Okay, I got you. Do not move.
He woke up all of a sudden disoriented and freaked out.
Don't even pinch me.
Do you have room in that arm to give it IV? There's always chemical ways for having patients cooperate with us.
You know you just clocked me. I really don't appreciate it.
I don't want an IV. Come on, ma'am.
Giving me
What's your first name?
Come on,
What's your
man.
name?
Thomas, man.
Thomas, you need to chill out, okay?
Please, you're scaring me with all this stuff.
Just relax, Thomas.
I'm going to be giving you some med to make you calm down. I'm giving you some
Thomas,
medicine.
listen to me. Thomas, we're going to take care of you. You need to cooperate with us, okay?
He's acting all wild, and I don't like young people get hurt. I mean, that's the whole part of my job, is to prevent injuries.
Okay, now that we've seen that video, I'm going to go ahead and demonstrate how we actually administer Narcan. We're going to be giving the patient 0.4 milligrams, which is usually not enough to wake them up, but it should be enough to support the respirations. So you find the patient's nostril, you put this right in the nostril, and once you have it firmly secured in the nostril, you're just going to push down on this here, plunger, and push the medication in. Now my medication has been administered to my patient. Now I'm going to reassess my patient to see if this is going to start working. I'm going to watch the chest rise and fall again. That same process I used before for 15 seconds, and counting how many respirations, I'm going to see if that is improved. If not, I may have to give it. For the second dose is the same as the first dose. They're still going to need an ambulance because the patient still has to be evaluated by a physician. And also, the medication we're giving may not last that long. The opiates in their system might last longer than this medication does. So the patient may need multiple doses before the opiates they have on board are going to wear off. More people die each year of opiate overdoses than died from gunshots in this country. In 2016, there's over 50,000 people died from overdoses. Not just heroin, but that's overdoses altogether. And what this does is it helps save those patients. Right now, pretty much anybody can carry this administered to anybody, where normally you have to have a prescription to give medications. Narcan is one of the only medications that you can give to somebody, to anybody, even if it's somebody you don't know, with no repercussions. So anybody can do this. Now, this video is not intended to be a process to actually certify anybody in the process of administering Narcan, but it's just to show you some of the steps and some of the things you can do for this. Now, this can make a big difference. It can actually save a person's life, because if this medication is not given to them, they could not be breathing, and therefore they're going to die. Thank you for watching.